We're joined now by Dr. Avi Bhatia, who's a GP in Long Eaton and chair of the Erewash Clinical Commissioning Group. And Dr. Bhatia, we know that Luke's mum had pancreatic cancer in this case, which I believe is the hardest cancer to detect and often treat. So why don't doctors consider cancer first when they are diagnosing a patient? Or maybe they do and we're just not aware of it?
I think most doctors do. They will consider it when diagnosing a patient. When you're given specific symptoms and signs, you will always sort of be thinking of it. There are very specific sort of symptoms, signs that a patient will have that will point you towards a cancer. We call them specifically red flag signs, and there are specific criteria that we have as GPs, as clinicians.
11 times to go backwards and forwards to a doctor and not to spot those red flags, as you call them.
I think so, yeah, and I think this is a very tragic case, and I think it's a good idea that this is brought up and is aiding a discussion on it. It's difficult to comment on whether any of those red flag symptoms were exhibited at any time.
They might not have been present.
It might not have been present. It's difficult also when there's not a degree of continuity with the same clinician or GP each time, when the story is having to start from the beginning
all over
every
again.
time.
And given that it's predicted that 50% of us will be unfortunately diagnosed with cancer at some point, is it unrealistic to expect that you can screen everyone all the time? I mean, that would be a mammoth task, wouldn't it?
I think in utopia you would love to be able to do that.
Yes. And lots of other things.
And lots of everything, really. And we try and put that in place for certain things, non-cancerous things. There's a cervical screening program, there's a breast screening program, there was what we call a fecal occult blood screening program for bowel cancer. I think what we have to look at is spotting the signs, which are the red flags, early, being able to then get access to those diagnostics that we need early in terms of referrals, or even GPs being able to access certain diagnostics rather than having to go up to the hospital for them.